Hello, today we'll deal with the differential diagnosis of schizophrenia. We dealt with DSM-5 criteria in another video. That is meaning we diagnose patients with schizophrenia with a criteria called DSM-5. And one point in that is saying that we need to exclude other diseases that could have similar symptoms to schizophrenia, but they are not schizophrenia. There are many diseases. And today we'll deal with these diseases. We will differentiate between these diseases. And this is called differential diagnosis. So we have 5 diseases that we know are beginning with schizo. And that is confusing, of course, because we have schizophrenia, and we have schizophreniform, and we have schizoaffective, we have schizoid, schizotypal. As you see, all beginning with schizo and ending with phrenia, phreniform, affective, id, or typal. Okay? And the most severe of these diseases is schizophrenia. Then we have schizophreniform, and so on, and the list goes down. What I mean is that schizophrenia is diagnosed when we have a disease for more than 6 months. Schizophreniform is when we have schizophrenia for less than 6 months. Then it's called schizophreniform. There exists also another disease which is called brief psychotic disease, and this is when we have less than 1 month. It's brief. It's psychosis for a brief period. As we know, psychosis is delusions, hallucinations, and so on. These are the positive symptoms in schizophrenia. Please check the video about symptoms, and then you will understand what I mean. So psychosis means hallucinations, delusions, which are positive symptoms. And we have brief psychotic disease, which meaning for a brief period of time, which is less than 1 month, we have psychosis. When we have psychosis or schizophrenic symptoms for 1 month to 6 months, we have schizophreniform. When we have more than 6 months, then it's schizophrenia. Then we have, as we said, schizoaffective, affection, emotions. These mean that we have psychosis together with mood disorders, for example, or depression or manic disease. The difference between schizoaffective and another disease, which is very important to know, is psychotic mood disease. Psychotic mood disease, as it suggests in the name, we have psychosis and mood disease. So what's the difference then between psychotic mood disease and schizoaffective disorder? Schizoaffective, we said we have psychosis and mood disease. The difference is in schizoaffective, we don't have to have mood disease. We can have mood disease or without mood disease. We can have depression or manic disease. We can have other spectrum of disease. In psychotic mood disease, we have to have psychosis and mood disease. Then we have also this disease which is called delusional disease. Delusional disease is only delusion, not hallucinations, no negative symptoms, no other symptoms of schizophrenia, only focused on delusional disease. As we know in schizophrenia, we have positive symptoms. As we know positive symptoms, we have hallucinations, delusions. So delusion is a part of schizophrenia, but in delusional disease, we only have delusion. We don't have anything else. That's also interesting. So we have psychotic mood disorder, we have psychosis and mood. We have delusional disease, which is only delusion. Then we have unipolar depression. That is a depression as a base disease, together on top of that, a psychosis. And then we have unipolar depression with psychosis. So not schizophrenia. And we have bipolar disease with psychosis. Bipolar disease, as we know, is depression and manic behavior. Therefore, it's called bipolar. Unipolar means only depression. Bipolar means depression and manic behavior. And we also have then bipolar disease with psychosis. So we have depression, we have manic behavior, and on top of that, we have psychosis. That is also not schizophrenia. And then we have other patients, for example, young autistic children. Autism. When we have autism, and then on top of that we have psychosis, and if it's less than 1 month, then we say it's an autism plus psychosis. We don't say it's schizophrenia, but we should consider schizophrenia if the psychosis part and will be more than 1 month, so for more than 6 months, then we need to consider schizophrenia. So when we're dealing with personality disorders, which we said were these schizotypal and schizoid, these are more, schizotypal is more like an odd belief. The patient have some beliefs that are very odd, but it is not a delusion and it is not hallucination. Schizoid, meaning that we have lower functioning, lower social functioning, and there is no psychosis. So this is schizoid. This is also not schizophrenia, because there is no psychosis here. Lower social functioning, yes. As we know in schizophrenia, we have lower social functioning, but there's no psychosis. That's a schizoid. Schizotypal is very, very light. It's only an odd belief. So, to conclude, 5 schizotypes. Schizophrenia, more than 6 months. Schizophreniform, less than 6 months. Schizoaffective, which is psychosis and mood or depression or manic behavior. But it doesn't have to have, as we said, mood, because that was psychotic mood disease. Then we have schizotypal, that is odd belief without any real delusions or hallucinations. Then we have schizoid, which is lower social functioning but no psychosis. Then we had brief psychotic disease, which is a period of less than 1 month of psychosis. Schizophreniform, as we know, had 1 month to 6 months. And then we had schizophrenia being more than 6 months. Then we had delusional disease, only delusional disease. Then we had psychotic mood disease. Then we had unipolar disease with psychosis. Then we had bipolar disease with psychosis, and so on. And then we had also this autism plus psychosis, which is less than 1 month. So in order to diagnose now patients with schizophrenia, first of all, check the DSM-5 criteria video. Look at the symptoms there, what is needed, and we need to have more than 6 months of symptoms, as we said, and we need to exclude all these diseases, what we talked about today. And the most important thing also, a reduced social functioning of the patient. So it's not enough to have positive and negative symptoms and so on. We need to have a reduced social functioning of the patient so he cannot perform so good in school and job, and the hygiene is bad and so on. So thank you very much and have a nice day.